we'll get started. Hannah may pop in and I'll just hand her the microphone. Thank you guys so much for coming, and to you on Zoom as well. Thank you so much. We'd start first with introductions. Tell us about who you are and what you do at your job and kind of information. We'll start with, if you don't mind.
Ladies, okay, ladies first.
Ladies first. Okay, we're gonna start with Laura.
There's Hannah.
Sorry, I got stuck by someone outside that was very distracted.
No worries, we were
I
just,
don't work here.
just starting with introductions, if you want to come and take the mic.
Okay, perfect.
And we're starting with Laura, ladies first.
Yes. Go ahead, Laura.
Okay. Hey, my name's Laura Townsend. I'm the Community Recovery Navigator at Peninsula Outpatient. I've been in this role a little over a year, but I've been with Peninsula about 13 years.
And I'm Katie.Spittler. I am the director at the McNabb Center for our Adult Substance Use Division. I've been at McNabb for 15 years as of today, actually, and I have been at Centerpoint and MAT, which I oversee currently, for 6 years.
And I'm Katya.Macias. I work, I'm the director of enrollment for River Valley Health. And I've been working with them for, I think, 8 years. And in our department, we manage the grants and funds for patients that don't have insurance. So anybody who's uninsured or underinsured, they get referred to us, and then we help them get into a grant or get them insurance.
Hello, my name is Derrick.Folsom. I'm also from River Valley Health. I've been there 32 years. I have knowledge in affordable healthcare, teen care, covered kids, and also the Knox County Healthcare Program. And as of about 15 days ago, I did that. Now I am a community health resource person for our new grant that's just in case management, intensive case management, which I'm learning, but I'm glad to be here. Thank y'all for having me.
Okay, thank you guys. So before we fully dive into how people pay for treatment, can someone from our panel or a couple walk us through the different levels of care available for substance use treatment and what kind of services are typically involved in each level? Katie? Maybe Katie?
Sure, I can speak to that. So I'm going to start with the highest level of care and work to the lowest. So there is 4.0, which is hospitalization. That is usually for people who can't keep themselves safe within the community or in a residential treatment center. McNabb actually doesn't have that service particularly, so I can't speak in depth about what services are provided in there, but it's usually highly intensive medical and clinical services. The next one I'm going to go to is detox or withdrawal management. And so that's a 3.7D. And on that one, we provide withdrawal management services for individuals who are detoxing or withdrawing from opiates, alcohol, and benzos. That's usually what that level of care entails. And then it also has 24/7 nursing and usually a medical director who's providing protocols in relation to those services that are being provided. From there, residential care is next, 3.5. This is for any individual suffering from any substance use disorder who cannot safely quit or reduce their use in the community setting, either due to environmental concerns, medical issues, or mental health issues. And so what's provided there and usually is not only oversight from an APRN to address those co-occurring issues, but also intensive services surrounding psychoeducation, coping skills, clinical services. I know at Centerpoint specifically, I can speak, they're each assigned a therapist that they meet weekly with, and for individual therapy, family therapy is offered, and then they have group therapy 5 days a week. But they are doing groups throughout the day, just learning to enhance those skills because they may not be in place. And so we're providing those skills for when they leave. Then there's intensive outpatient services, which is the next level of care. I think technically it's 2.1 in ASAM dialogue. And that is for individuals who really aren't quite in need of residential care for safety reasons or because of the increase in use. But what I really like about intensive outpatient is it's pretty intensive treatment, giving you real life skills that you can practice at the same time. So those individuals usually attend groups for it's either 3 or 4 times a week for 3 hours at a time. There also may be individual and family sessions that are offered in that level of care as well. But we're really focusing on, again, that basic psychoeducation, those coping skills, processing, what has led to their substance use. And also there's usually case management with that so that they're able to refer for any additional services that they need. And then the last level of care is outpatient, which is 1.0. And so that is a wide gamut of a variety of different services. It could be recovery support services, peer services, individual therapy, MAT treatment, all of that stuff that can be provided on that level of care for individuals. And what I will say is it's completely normal for people to fluctuate in and out of that continuum of care. I think what's important to stress to people is that this is a lifelong disease. And so there is probably going to be needing treatment throughout their lifetime, as well as even after they transition from residential care or things along those lines. So if anyone has anything additional to add, they can feel free, but that is my spiel about the
That was a very good answer.
Yeah.
Well, thank you, because I think each level of care has, I don't even know if this is working. Can they hear me online without this?
Ask and they'll tell you.
Hey, can you guys hear me? I feel like I talk pretty loud.
Jack says yes. He's got a thumbs up.
I don't even think this works.
I'm thinking that it,
I think it's dead.
I think that the battery was beeping at me.
Okay. All right.
I will say that some places offer PHP, which is partial hospitalization program
Yes, they do.
as well. I don't know the numbers to go along with that or anything.
2.5. Again, that isn't something McNabb technically does, but thank you for bringing that, Laura, because it is an option. I do know that other providers in the community do offer it. I am not fully aware of the services that go into that, though.
Yeah. Okay, thank you. I just wanted to start with a basic different levels. So when we're talking about treatment, each one may have its own obstacles. So I want them to be familiar, if they're not already, with what we're talking about in each one. So, okay. So with this level of cares in mind, what are the typical costs associated with different types of treatment for the person? Maybe not the facility, but for the person, whether that's like a copay or, I mean, it can be different based on each level of care, and you can kind of just speak to where you maybe have your most expertise.
Well, I can speak about outpatient because at River Valley Health, that's basically what we're doing. It's the 2.0. So it's outpatient, and the typical expenses that you will have, of course, it would be for, depending, it's if you have insurance or if you don't have insurance, but what we basically charge for, it's for follow-ups, intakes, doctor visits, with a MAT doctor, there's drug screens, there's lab work, there's medication that is also involved, and those are the ones that are at the top of my head. I'm pretty sure there's a few more out there. There's case management, there's peer support, there's a lot of different services that kind of get lumped into the visits.
And I will say with residential, a lot of times it is a deductible that they have to meet in order to get paid, because that is obviously a higher cost in general if they have insurance. But again, like Katya said, like we have the options for grants that would allow services to be covered for the clients in all levels of care and continue with them. So.
I can speak for like Peninsula Hospital. I don't work in Peninsula Hospital, but they have grants to cover, of course, most people going there are not going to be voluntary, but even if they have insurance that won't cover it, they're not gonna have any out-of-pocket costs. And for outpatient, it's similar to, if they don't have insurance, there's definitely grants we can cover for them. But if they do, the copays just differ whether they're doing intensive outpatient, a group versus a nurse practitioner appointment, or just depending on the service.
Where do you see people run into the biggest challenges when trying to figure out how to pay for treatment?
In my experience, it's been the private plans from Marketplace that have a high out-of-pocket need to get to treatment, and then they can't afford it.
And I second the motion, but I also know, because I did it for the last 12 years, the Marketplace does have its problems, and they help people too. They also got some people seen. You got some pretenders, people out here signing, low income people up without their knowledge, and that's how they're getting the short end of the stick when it comes to out of pocket and stuff like that. And I had people come into my office and say, "Well, I got it off Facebook." So they would sign up for it. They saw it. They made the phone call. Then they talked to somebody, a broker from Florida, North Carolina. I remember telling Katya that they'll call our people in the state of Tennessee, not knowing the plans, and they would sign them up. And the first thing some of the people get was zero deductible, zero premium, but they don't see the $5,000, $12,000, $13,000 out of pocket. And so, and what she said, that was the Marketplace had its role in it for as the pretenders or the people who want to pretend that there was, real certified application counselors or navigators to sign people up, which we knew the Tennessee plans, all plans, the zip codes are different. Memphis have a insurance called Oscar, but it's not for East Tennessee. And so, and so that was one of the things. I just saw somebody right before I changed positions is they had Oscar, and I'm like, how did they get it? They got it talking to a broker. So, and I'm not trying to defend Amber by any means, but that kind of gave them bad rep as well. But now, did they do some of the stuff? I'm pretty sure they did. But the insurance thing, when they see 00, they don't pay attention to the out of pocket. I don't know if they explain it, but when I talked to some of the consumers at the time, they would never explain about out of pocket. They never explained that you have to have some type of income to be able to get on this when you file taxes, and then some of them went on taxes from the year before, and that was a no-no. It's the year that you're in and the year you have to project what your income will be at the end of the year, like 2025, of course.
Insightful. So for those that do kind of have that limited insurance coverage or no insurance at all, has there been any successful strategies for how to get them into treatment? Specifically those that, like most, are kind of familiar with grant or scholarship beds, but specifically those that maybe their insurance doesn't cover at all and they don't have the means to pay. Are they still eligible, or do you know of programs that they can utilize still, or?
At River Valley Health, they are still eligible. It really depends on how high their income is, how their deductible is. So we need to determine to see what the need is based on like how many grant applications, spaces we have available. So we have to really review what do we have for the year, determine how many we're gonna be enrolling. But most of the time, I know for this last year, I think almost everybody that wasn't able to afford their high deductible, we were able to enroll. So it's fortunate that the state with our grants that we have and SOR and COC that we're able to do that. And I'm also grateful that they're every middle of the year, they're also following up with us to check to see do you need more funds? Do you have extra funds that you can spare for another clinic or another organization that needs more funds? So that happens all the time every year. And we're able to enroll more patients that way.
That's nice. Always nice to be asked if you need more funds. Amy, what about within McNabb? Are there options for clients who maybe have insurance coverage, but they can't pay those?
I think we look at that on an individual basis as they come through and what we're able to look at or utilize for our grants. You know, we do have some grants that are uninsured and some grants that are uninsured and underinsured, which we would kind of consider somebody with a high deductible underinsured if they can't afford it. And so I think we look at those options and kind of just take it on a case by case basis and see what we're able to do to best serve the client in that realm.
At Peninsula, for just outpatient, we do have programs for people that can't afford their co-pays and things like that. So we will still see people, and if they receive a bill, we have a program called Charity Care Financial Assistance that they can apply for. So if they're, you know, even if it's just like a Medicare copay that they can't pay because if they're very limited income, they can apply for that each year to pay off their back balance with Covenant. And then, of course, we all are familiar with behavioral health safety net, but that can't help anybody if they have any kind of insurance. So.
Are there any common myths or misunderstanding people seem to have about what's covered or what financial help is available frequently for you all?
Can you say that again? I'm sorry.
So like, do you ever have, I don't know, like word on the street all the time of like what's covered or any misunderstandings about coverage for their insurance or what can be covered or what grants cover within their treatment, things like that?
I think people do get confused in general about different grants. Like there's several people that will come to us, and even back when I used to do safety net, you can sit down with somebody, but maybe they're really overwhelmed that day and they don't understand that that's just a grant for behavioral health. And they think maybe they're getting like actual insurance to use somewhere, things like that. Just when people have a lot going on and they're new, like there's a lot of in and outs with the grants. Or for example, like we have a SOAR grant for intensive services at Peninsula, but then they'll have to switch back to behavioral health safety net when they're done with that. So there's kind of a lot of back and forth that can be confusing for them.
We've talked a lot about kind of what different options, and it's not that most of the time it's very individualized, and that's wonderful. What are some questions that people can ask or should be asking as they're calling around these facilities? Like, do you have any advice on what to ask for those who don't have the insurance or the coverage to pay for it? Or even, let's see here, or how to know kind of what they qualify for and how to get into treatment. Like, what are the types of questions they should be asking? Because I feel like a lot of them don't always know even how to get into that conversation to see what they're eligible for and what they're not. So any advice on that?
I would say to start with meeting with a recovery navigator if you have the access to, because they can help walk you through that step by step. If you're not at that level where you're in crisis or going to an ED for withdrawal or something like that, there are outpatient recovery navigators too. I think you guys have some at Cherokee Health, right? And so I'm the community one at Peninsula. I'm sure other like case management type roles could help too. But I think that would be a good place to start, because all the lists that are given can be broken down like, hey, here are your grant vet options. Here's this insurance option. Because one of the top questions is going to be, what insurance do you take, or are you in network with my insurance kind of thing.
I'm along with her when people will come in and sign up. First thing, when I'm signing them up, we talk about insurance, and they never had insurance. I always ask, you called and see, do your doctor take this? And we did that before you went out. They come in with a specific element or issue, or they want to get solved or get seen. We call the insurance company. If not, we'll call the rep that I got to meet and ask, can you give us some information? Do they cover this? Whatever, because the person probably want to choose this plan and stuff like that. But that's one thing I did was say, you call first, you ask, and that's what I'm doing from the part of when they're trying to sign up for insurance. I had that conversation with them. Let's call, let's do what we have to do to see if they take this, you know, because I didn't want anybody to be mad at me for not But you didn't tell me I signed up for this insurance, they didn't take it, but they had 4 to choose from. So, and whichever one that did, if Blue Cross didn't work, we called Cigna. Cigna didn't work, we called Ambetter, they didn't work. So we just did what we had to do in order to get them signed up and make sure that they was able to go get that taken care of and to make sure their doctor did take it. So, and I explained to them about copay. I explained to them about deductibles and especially the out of pocket, because a lot of people don't understand the out of pocket. You know, it's, you know, they came about 12 years ago when the affordable health came out. But once, you know, you do that, you send them on their way and hope that they get it. But I also left it open for them to call me back if they had any questions. So.
And we also have community agencies like, you know, the Gateway with Metro Drug Coalition that have people where you can just walk in directly to get assistance with that. We have Empath, so we have programs where people don't have to do it themselves now, because it can be really overwhelming.
Yeah, absolutely. Okay. Let's see here. So you've kind of already touched on what was going to be my next question of, are there people or resources in the community? Are there any that you'd like to add that kind of can be available for people to be walked through kind of what their coverage can look like? For those that it's not like a crisis point, maybe they're just wanting to get into some outpatient or, you know, IRP.
It's okay, good question.
So we mentioned some about like the Metro Drug Coalition at the Gateway having those people available. And did you say Empath does as well?
I mean, I would send people to Empath if it wasn't time for, like, if there was no recovery navigators at the hospital kind of thing, and they needed like there's not a lot of after hours, like immediate help. We also have Lifeline that you can call for those that are maybe a little more stable and able to call and navigate things themselves.
Yeah, just any kind of resources that you're aware of to help people kind of navigate either getting into treatment or just their coverage options.
At River Valley Health, we, if a patient doesn't know where to start, I think the first thing we do is we advise them just to make an appointment with a case manager, because they're going to be able to offer them a lot of information and a peer support. For our clinics, I'm not sure if they need to be like a current patient in order to have peer support, but we do have that service. So it's something that I can double check to see if they're able just to make an appointment for that. But I've talked to some of the nurses in the MAT clinic when they're telling me that the patient has to wait. This is the first time they come in, they have to wait a week or 2 weeks for them to actually come in and be able to speak with a clinician. So the first thing that they do is that they'll make them an appointment with a peer support or a case manager so they can at least get that started, and also behavioral health. So those are some of the resources that we use, and sometimes we even refer them to McNabb because they just don't want to wait. So we do that as well.
I will say, like, a lot of our staff are just trained if clients do walk in to even just start asking them questions in order to do a screen on them to get what level of care. A lot of clients don't know, you know, what their options are or what they exactly need as far as level of cares, like we talked about when we originally started. And so our goal is to just get the information and then kind of make recommendations from there, and then also, you know, make referrals. Like, it may be a simple, like, you do need center points, so we're going to contact, you know, the admissions coordinator over there and things along those lines to help them navigate that, because as everyone said, it's extremely overwhelming and it can sometimes be a difficult process already. So we don't want to make it any more difficult for them at that time.
So if there's either a care provider, like a case manager, or a family member, loved one, friend, fill the blank, that is wanting to support them while trying to navigate the system. I think that kind of dealing with the complex insurance or even the grant systems of which can go where, what's kind of your advice with them about just getting started, like getting connected to the right person to get started on that journey? there's been some feedback that since the changes in, like, since COVID and changes of staff and just all the changes within the community from that time, that there's been a lot of turnover of staff. And so there's been a lot of questions about how do I even get somebody into some of these services? Like without the go round kind of thing.
So for me, like, I'm not tied to just helping Peninsula clients. So if anybody ever needs help, like, that's what I'm here for. Like, that's what my job is to do, to connect them, whatever level of care that looks like. And I mean, from like working with people in the recovery community, like, I haven't met a single person at a treatment facility or even in like business development that isn't going to help the person regardless. So we kind of all work as a team of like, I can't do this, maybe I'll run this insurance, man, what about you? Pass them on. Like, nobody's going to leave them hanging.
So just stay connected with the
I mean,
client.
find one person like that and then they'll try to connect you with others. I mean, that's kind of how I see it happen most of the time.
That's great.
I agree. That's true. I see that.
Okay, thank you. Alrighty. So if you could just give one piece of advice to someone struggling to understand how to pay for treatment, what would it be?
Basically just to ask questions, because I mean, it can be very confusing, overwhelming. It can be if you start explaining, this is how this works. And there's so many different scenarios that could happen. But if a patient just comes in and whoever they're talking to, whether they're talking to a nurse or a front desk, they can just ask, they can just mention, I don't have insurance, how am I gonna pay this? And usually the front desk will have some information of grants or how to apply, or just let us know, hey, you need to go to the 3rd floor, this is where you can apply. So just by asking, like, how do I pay for this service? And ask me anything.
And even like if you're in sober living already, but you have a relapse, things like that, I mean, reach out to your house manager, your program director, reach out to a case manager, whoever that may be, like justice involved reentry, or for unhoused folks like that, they could talk to their outreach workers. We're all kind of connected in that sense. If you come in the health department, I'm sure you could ask somebody here for assistance, all of that. So just don't be afraid to ask for help. It's complicated for everybody.
Yeah. I would agree with everything that these ladies have said in regards to that, and just knowing too that it is complicated. So, it may unfortunately take a few places or a few people talking to. It's not always going to be the first one you call potentially, which I know is extremely frustrating, especially in certain situations. I know we run into that a lot of times at Center Point with residential. People don't feel well, or it's a very small window of opportunity, but even the loved ones, I know it can be frustrating, but a lot of times the people coordinating have a lot of contacts other places and can link you to where you need to be in order to get the services you need.
You have anything you want to add?
I agree with that. Yeah, so.
In most places, I think, like, I know resources change, but generally, like, I know no one can see it, but just like a substance use disorder treatment list, like that most places like MDC would have, that breaks it down, because you have your faith-based programs that people can go to as well. And then the few grant bed options, and then, broken down by private insurance, TennCare, things like that. So some people just don't have anything. Some people aren't from here, and then they just walk into the gateway and have been here 3 days. They know nothing. So just even give them lists of what our hospitals are and where there are navigators and like maybe some sober living options. That's a lot to them to start.
You said Metro Drug has those lists available that I think they would share that with other providers or probations or whatever.
And like, I have my resource book and just take this everywhere to hand to people too, if they need it. So I'm sure other people have the same information to give.
That's great advice. Do you all have anything before I open the floor for some questions online? You virtual people, if you want to start typing in your questions to Pam.
Or they can talk.
Oh, or you can talk this time. Last time
I don't know about that. That speaker kind of scares me now.
yeah, well, it was startling. Is there anything else that you guys would like to add that we didn't cover I know it's hard, it can be hard to speak because there's so many different moving parts and people have such unique plans and coverages and, all these different, there's so much that you could speak on, but is there anything generalized that you would like to add that we didn't cover already? As far as navigating the system and getting access, it's really all about getting access to their treatment. So.
I would just say, I know it can be frustrating, but continue to make those calls, walk into some of these walk-in clinics that, we've mentioned, or if it's for clients and it's not something you can do, tell them to go to these places because that's a starting point. That's why they've offered these walk-in hours and stuff, is to get people these information without an appointment or wait time.
It's okay if you don't. That just means we ask great questions. Okay, any questions online, Pam?
Anybody on Zoom? Does McNabb, this is from Jack Dennis, does McNabb's IOP grant program accept underinsured clients? Has insurance but cannot, I was reading it from the pop-up just a second. A little gun shy about looking at things. Let's see. Okay. Does McNabb's IOP grant program accept underinsured clients? Has insurance but can't afford IOP?
I would say that we have, and I would say that that goes back to the individual basis that we would look at if a referral, sorry, I don't know why I turned around. If a referral was made in regards to that, but we usually, yes, do try to work with people in regards to their insurance if they are considered underinsured.
Any other questions from the Zoom? No.
Okay. Well, thankfully people don't have to figure it out on their own. So that's always encouraging. We have knowledgeable professionals in our community who can help guide people through this process of trying to pay for substance use treatment. I think now more than ever, we have a lot of navigators. We have a lot of just people specifically to help connect with resources. And I think that that's wonderful and much needed. And we appreciate the work you do.
Yes.
So thank you panelists too for taking your time today and for the virtual attendees. I'm sorry again for the disruption. Please join us at our next panel series. It's about inpatient substance use services on Wednesday, September 17th from 3 to 4 at the Metro Drug Coalition. If you're attending in person, they have additional parking at the St. John's Lutheran, church down the street. So I think most people have been there a few times to know that. And get your coffee from the soberistas, as Ann would say.
Yes.
All righty, thank you.